Our next presenter is Nicole Bartholomeusz, who is the Chief Executive of cohealth. Nicole's worked extensively in public health and government for over 20 years and has a background as a clinician as well as having an MBA. She's got a strong interest in health policy, service planning and design, and so it's great to have cohealth on board with this edition and to have the perspective of a major frontline health service provider to some of the most vulnerable and disadvantaged people in our community, and to hear about cohealth's view about the models of housing and support that we need. Thanks, Nicole.
Thanks, Jenny. Thanks for the invitation to speak at today's launch. I'd also like to acknowledge the Wurundjeri people as the traditional owners on the land on which I stand today and pay respects to their elders past, present and emerging. cohealth is so proud to be supporting this edition of Parity, and I'd like to give particular thanks to Nigel for sharing his experience earlier. His voice and contribution enriches this conversation. When I saw the topic for today's address, it occurred to me that the answers to this question are as diverse and varied as the people that we work with. There's no one size that fits all solution for the people that we work with, and yet there are some commonalities amongst the needs of all consumers. Critical to a person's recovery is addressing both a person's mental health and housing needs, and you cannot have one without the other. So coming from a large community health service, I bring a unique perspective of integrating physical health, mental health and social support services. In the past year, we provided services to over 46,000 consumers, which includes 1,600 clients who experience homelessness. Interestingly, of the 46,000 consumers who use our service, nearly 9% identify as experiencing insecure housing, a rate well in excess of the Victorian rate of homelessness of 41.9 for every 10,000 people. It's well established that people with poor mental health have far worse physical health outcomes. And I can't recall the number of people or clients that I've heard say that they've been to 5, 6, 7 GPs seeking physical health care, and for these care needs to be overlooked because of their mental illness. Our holistic care model integrates all aspects of health and also focuses on the social drivers of poor health, including housing, poverty and social isolation. Our purpose is to support vulnerable people who would not otherwise access high quality healthcare and social support services. An example of our work is our clinic in Melbourne CBD, who has a particular focus on working with people who are experiencing homelessness. And the services provided here from a range of practitioners acknowledge the breadth of care that those clients require. I'd like to share a story of someone that cohealth works with. His name's Patrick, and highlights his journey with us to find the keys to unlocking his recovery. Patrick's story demonstrates that these keys are not easy to find and do not fit perfectly every time. Patrick has a complex background, which includes chronic homelessness over 3 decades, complex mental illness and other physical health issues, and has been cycling through crisis accommodation and hospital admissions. Over a long period of time, Patrick and his care team unpicked the aspects of his life that were impacting his physical and mental health, including housing, substance use, income support, social connections, and living skills. Patrick's outcomes were improving, but finding housing that suited him was a real challenge. Providing Patrick with high-density public housing, even with all the supports in the world, was never going to work due to his history of trauma and chronic homelessness. He struggles with feelings of safety while in housing. Patrick has tried a range of housing options, including different locations with different supports in place. And what we've found is that the most successful has been a single level dwelling with a garden and a mixed community of public and private housing. This is a very common story, but what this story tells us is that housing options need to be highly flexible and centred on an individual's needs. Without the ability to transfer or move to different housing, we find that clients walk out of their housing because staying there is detrimental to their mental health. And this also speaks to the support services needing to be flexible as well. Due to the nature of mental health, support need to be dialed up and dialed down as people need it. Mental health is a chronic health issue, so support needs to mirror people's experience and their current setting. And when we dial it down because things are going smoothly or have improved, that doesn't mean withdrawing this support altogether. The importance of social connection cannot be underestimated. And I reflect on how we used to support people into housing. We thought we had done a good job when we secured them a home and provided transitional support. But we now know that social isolation is something that we address at the start of people's care and continuing to work on long after they have transitioned into housing. Patrick and others like Patrick need to know that their support is not time limited nor conditional. We're still on a journey with Patrick. He does not have a team of workers. He's in fact one of the team, and he is the expert in his team. Patrick's story, like many other people we know, exemplifies that wraparound integrated services which are person-centred, assertive, coordinated and holistic are the key to unlocking the door to recovery. Stories like Patrick's and Nigel's of resilience and survival are a powerful motivator for us all. Thanks for your time today.